I want to practically demonstrate on how to undergo CPR, Cardio-Pulmonary Resuscitation. When you see someone who suddenly probably fell, don't need to panic, you don't need to shout. You need to be calm and observe if there are danger where the scene occur. That is the first thing you should do. So when that is done, you now have to observe the consciousness of the patient. Is this person actually breathing? Is this person is responding? So you have to first raise the patient, the casualty leg up, suspend the leg for a quiet period of time, and the essence is to allow backflow of blood that probably have sequestered on this leg to flow back to the heart and supply to the brain. That is first thing that should be done. So after a while, you can now go for the airway to know if there is air that is accessible. So that can be achieved by tilting the jaw back with the mouth open. So in order to ensure that there is no obstruction. So when this is done, you can now observe if there is air flow. You can achieve that by ensuring that you use your ear to observe if there is air coming out from the mouth or probably from the nose. So you can observe that simultaneously by observing the tummy or at the chest to get to observe if there is any rise and fall, which will enable you to know yes that this patient is still alive. Having done that, you have to look out for circulation. Is there air circulation? Is the air circulating properly to the brain? So this is where chest compression comes in. When we talk about chest compression, it is done practically by using, probably if you are right-handed person or left-handed, just as I am right-handed, you place your hand below the centralized part of the heart. Heart is centralized, but below the breastbone, that is where you have your hand, and at the same time lock it with the other hand in order to give about 100 compared. Make sure that this compression is about 5 cm deep. 5 cm deep. This is done simultaneously. 400 compression for 30 times. All you are doing is to just enable a full air circulation in order to resuscitate the casualty. So having done that, definitely the casualty will come back to normal. But peradventure, after doing all this and there's still not a quick response, that is when you can now take the patient to a hospital. Thank you very much.